You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone podcast. This is the place where I talk all things mouth health, dental health and holistic dentistry. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. And today I am going to talk to you about oil pulling, what oil pulling is, how to do it, why to do it, what the benefits are, what the risks are, and so forth. If you want to know more about the oral health mouth-body connection and how to have a healthy smile for a healthy life, then you can hop on over to holisticdentistry.au or evolvedental.com.au. But for now, stick with me and let's get in the zone. Let's talk about oil pulling, what it is, and how to do it. Well, oil pulling is an ancient practice of swishing oil like coconut oil or sesame oil around in your mouth for several minutes. It apparently originated in India, but is now widely practiced. Widely, not wildly, but maybe it's wildly as well, practiced around the world. You can oil pull with any edible oil, but coconut oil seems to be the best one when it comes to improving your oral health. Now, if you don't like the taste of coconut, you can get the medium chain variety, which has no flavour, and there are other coconut oils where they take the coconut flavour out. So something to have a look at if this is something that you want to do. Now, why would you do oil pulling? Well, it's a way of you being able to rebalance your oral microbiome. So that's the type of bacteria that are in your mouth. And it's a easy and cheap way of doing this. And I've had people tell me that it's improved their bad breath, makes their gums healthier, and they feel it makes their teeth whiter. Well, so does it really work? Why would you want to do oil pulling? How is that beneficial? Is it better than using a mouthwash? Can it help support your oral hygiene regime? Is it something that is going to make your brushing and flossing go to the next level? Well, this oil pulling technique, particularly if you use coconut oil, because it is antibacterial and anti-inflammatory, can help reduce inflammation within the mouth and improve your gum health. But if you've got gum disease and you've got plaque and tartar sitting on your teeth, between your gums and under your gum line, oil pulling is not going to make much difference. You've got to get that treated, and then the oil pulling is going to be a supportive factor to keep you healthy and maintain that health. Now, there is a claim that oil pulling will help pull toxins from the rest of your body. It's going to do this, that, and the other and offer you all these wondrous benefits. Well, I don't think that's true. I don't see how swooshing coconut oil around your mouth is going to pull toxins from your bloodstream and detox the blood and cure all these diseases. To me, that is false and incorrect. So I'm going to look deeper into the science behind this and the myths and explain to you how to oil pull for the maximum benefit, because there are so many different strategies and theories and levels of advice that are out there. So with oil pulling, you swish the oil around your mouth as a replacement for mouthwash. Now, what bothers me here is that when most people rinse a mouthwash around their mouth, they do it kind of quite pathetically. It's like this little blub, 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 blub type thing, which I know you can't see because we're on a podcast, and I will do a video at some point when I get 5 minutes in between podcasting and doing dentistry and raising a family and mowing the grass on my acreage. So done properly, you've actually got to pull the mouth rinse or the oil around your mouth with quite a vigorous action. So it's almost like you're sucking it in and out between your teeth and pushing it and pulling it backwards and forwards. So you can use it instead of your mouthwash. When you use something like coconut oil, it can reduce the pathogenic, the nasty, bad, harmful bacteria and germs, the ones that cause cavities and gum disease in the mouth. And scientific studies do show it also reduces gum inflammation as well as having any benefits. Now, the traditional method of oil pulling involves swishing for a prolonged period of time, anywhere up to 20 minutes on an empty stomach. Now, if you are swooshing an antibacterial around your mouth for that long, at some point you are going to start destroying and disturbing your good bacteria. I think 1 to 3 minutes of oil pulling is plenty enough time to give you the benefits and support you having a healthy mouth. Any time over that is just a waste of your time, effort, and energy, and is going to probably cause more harm than good. Now, oil pulling's been around for apparently thousands of years. It became very popular since the 1990s. And look, if I had $1 for every time someone's asked me about oil pulling, I probably wouldn't have to still be working in my dental practice and drilling teeth. But I would be, because I love to do what I do, and I love educating and helping my patients to have a healthy mouth and a really functional, beautiful, balanced smile as well. So there have been all these, what's the word I'm looking for? Sorry, sometimes it doesn't quite come off the tip of your tongue as you'd hope it to. There's been all these touted benefits of oil pulling, and they, it's like oil pulling is going to be the miracle cure for everything. They claim that it can cure about 30-40 different diseases, and all of these diseases really have nothing to do with what's going on in the mouth. Oil pulling is not a disease miracle cure. These claims that go along with it have no scientific evidence and have never been truly proven or substantiated. But if you ask me, should I oil pull, Dr. Rachel, as part of my oral hygiene routine? Is it going to be a more natural way of doing it than using something like, I won't mention the name, but it begins with L, those type of mouthwashes that contain tons of chemicals and alcohol and blow your head off because you can't keep them in your mouth for more than about 3 seconds? Then yes, oil pulling is definitely better than that. And if you've got one of those big bottles of mouthwashes that I've just mentioned, then you can use it to clean and freshen your toilet. Probably better poured down there than in your mouth. Anyway, if you are thinking that oil pulling is going to detox your body and reverse and cure your diseases, then it's not going to work. So sorry to burst your bubble there. Sorry to upset you if that is what you think and believe has been going on. So let's have a look at it. Well, first of all, if you're going to oil pull, you need to actually brush and floss your teeth first. It is not a swap out. It is not I can oil pull and therefore I don't need to do anything else. So give your mouth a really good clean first. Brush, floss, use interdental brushes, water pick if you like, scrape your tongue, and then oil pull. You need about a tablespoon of oil in your mouth. It's quite a lot. It's going to be a bit of a mouthful. You want to swish that oil vigorously around your mouth, pulling it backwards and forwards between your teeth and over your teeth and all the internal workings of your mouth. And you want to do that for about 1 to 3 minutes. And it should be tiring because you're using a lot of muscular force to do it. Then I would recommend, particularly if you're using coconut oil, which is normally solid at room temperature, that you spit the oil out into your garbage can, into your rubbish bin, and not down the toilet or sink, because once it hardens, It's going to clog up your pipes. And if you're like me and you live on septic tank and grey water, I am telling you, you do not want to be clogging those pipes up. Definitely not. And then once you've oil pulled, you should rinse out your mouth. Now, you can do that with warm water. You can do that with a little bit of water and hydrogen peroxide, or water, hydrogen peroxide, and a bit of bicarb, because they're alkalizing and they will also help reduce bacteria. But you want to just rinse out everything that you've just dislodged. How often should you be oil pulling? Now, if you suffer from gingivitis, which is the Latin term for gum disease, you want to be oil pulling at least once a day to improve your gum health. Now, if you've got good oral health, you only need to be doing this process maybe 1, 2, 3 times each week. You don't need to be doing it on a daily basis if your mouth is in good health. Don't want to overdo a good thing, do we, guys? So you want to, just to reiterate, clean your mouth first, swoosh the oil vigorously around your mouth for 1 to 3 minutes. If it's a hard oil to start with, like your coconut oil, it's solid at room temperature. Don't spit it out down the sink or into the toilet, because you're going to clog your pipes up. You want to spit it out in the trash. Use it every day if you've got gum disease and you're wanting to improve the gum health, and then 1 or 2 times each week is sufficient when your mouth is healthy. So what oils are you going to use? You can use coconut oil. This is apparently the best oil because it does have anti-inflammatory and antibacterial properties, and it has the ability to balance or rebalance the bacteria in your mouth. Just make sure you choose an oil that is cold pressed and organic, and that you like the taste of. You're going to receive the same benefits. So some of the oils you can use are coconut oil, sesame oil, cauliflower oil. Where did I even get that from? Sorry, sunflower oil or olive oil. Now, coconut oil is an antioxidant and it's an anti-inflammatory packed powerhouse. It contains lauric acid, which is a medium chain triglyceride, MCT, that is really effective at killing bad bacteria, the type that can cause tooth decay and gum disease. The same compounds will reduce the amount of plaque that builds up on your teeth, and it's going to reduce your chance for gum disease. I have used coconut oil to oil pull a few times. Wasn't really a huge fan. Not a big fan of that feel in my mouth or the actual taste. But you can get just the MCT version, which is liquid at room temperature and doesn't have any flavor. And you can also get coconut oils that are deflavored. So you might want to try some of those. If you find it undesirable, then use a different oil, sesame oil or another oil that you actually like the taste of. Avoid seed oils, the industrial type ones, because they have trans fats in them. They're too high in omega-6, and if you switch out your omega-3-6 ratio, you can have negative health impacts because of that. So I would stick to something more like your coconut oil, your olive oil, or sesame oil. So what are the health benefits of oil pulling? Well, let's go into that now, and then you can determine whether this is something that you want to try. Now, so science says it's cost effective, it's cheap, and it's got no major side effects or dangers, and may have beneficial effects on your dental hygiene. I think it does support a healthy oral microbiome, and that's going to be the protective, almost like immune system base for your mouth. Your good bacteria helps suppress the bad bacteria, and that reduces your risk of having dental and oral problems. Now, the biggest benefit that most people are going to get from oil pulling is the reduction in the risk of gingivitis, aka gum disease. Gum disease is an infection caused by the bacteria in your mouth where your gums become swollen, inflamed, and tender, and they bleed. And these are signs that you have gingivitis. You've got to take these signs seriously because untreated gum disease will lead to major oral health issues like periodontitis, which is the destruction of your gums and the bone that holds your teeth in. But this also allows bacteria and toxins and inflammatory byproducts from your mouth to spread via your bloodstream around the rest of your body. And gum disease is linked to things like cancer, diabetes, cardiovascular disease, stroke, high blood pressure, Alzheimer's, dementia, and even types of cancer. So, oil pulling reduces the level of gingivitis causing plaque bacteria. And I think this is a dual or a multi-fold effect because you've got the anti-inflammatory, you've got the antibacterial action, but the actual action of oil pulling means the oil acts as an emollient. It actually thickens up and suds a little bit like soap, and that cleans the teeth and gums from the unwanted buildup. They've found in studies that you get significant improvements in the levels of plaque after oil pulling, usually after about 2 to 4 weeks. They record a small increase in the benefits of oil pulling over chlorhexidine or traditional type mouthwashes. No research has really been conducted on long-term oil pulling and gum disease risk, but I can't see that prolonged usage and doing this regularly, once or twice a week, more if you've already got poor gum health and you're aiming to improve them, I can't see that it's going to actually do any harm. So if you want to have improvements in your gum health and you want to keep your gums healthy, then by all means, oil pull. But you don't need to do it for more than 1 to 3 minutes, and you don't need to be doing it every day. There is such a thing as having too much of a good thing. Now, there's people saying that oil pulling is going to reverse cavities. I don't think that is necessarily true. And what do we mean by reverse cavities? If you've got a massive, great, big freaking decay hole in your tooth, nothing is going to reverse that. But oil pulling may help remineralize your teeth. Now, if your teeth dissolve, that's demineralization, and that happens more than they remineralize, which is to reharden, and that goes on too much, you will end up with porous, weak areas in your enamel, which are chalky and soft, and allow bacteria to then invade into your tooth and destroy your tooth structure. So I think that yes, oil pulling can remineralize your enamel. And if you want to categorize demineralized enamel as an early cavity, then yes, you can reverse and remineralize these early cavities naturally. No good if that decay is already in the dentine, the next layer of the tooth. But if you can support the balance of good to bad bacteria in the mouth, oil pulling is going to help remineralize your enamel and play a part in preventing cavities and reversing those early, weak, chalky enamel lesions. Your teeth are designed to reharden and remineralize themselves on an ongoing basis. But this is only possible if you have the proper nutrients that supply all the minerals and building blocks that help replenish the enamel. And it's only possible when you don't have the cavity-causing bacteria present. So if you can reduce the amount of harmful bacteria in your mouth, such as the Streptococcus mutans, then you can reduce your risk for dental decay, because Streptococcus mutans are the bacteria that predominantly feed off the sugars in our diet and lead to cavities, or what we call dental caries. Oil pulling with sesame and coconut oil eliminates excessive Streptococcus mutans within the mouth just as effectively as your standard mouthwashes do. Now, you need to be doing oil pulling for at least 3 weeks, and this is why coconut oil pulling is a long-term dental health solution and not a quick fix. Now, the key to healing and not having tooth decay is diet. You got to eat the right foods. If you feed bacteria sugar and you're nutrient deficient, you're acidic, and your body is inflamed, you are much more likely to end up with dysbiosis of the oral microbiome and end up with too much of the bad, nasty germs in your mouth that will cause cavities and gum disease. So coconut oil pulling will play a role by helping to rebalance and redress that dysbiosis and rebalance the bacteria, the oral microbiome in your mouth, which then helps suppress and keep the nasty bacteria in check. The other things coconut oil pulling can do is reduce the symptoms of bad breath and oral thrush, and I'll go into that now. So for bad breath, if you have got an imbalance of nasty, bad, unhealthy bacteria, not that they're unhealthy, but they're unhealthy for you, versus good, non-harmful bacteria, then oil pulling, then you will more than likely end up with bad breath. Now, oil pulling can support your saliva's efforts to disorganize bacteria without killing the bad bacteria and drying your mouth out. Regular oil pulling has been shown in studies and trials to kill the bacteria that are responsible for halitosis, which is the name for bad breath. These bacteria release volatile organic compounds that sulfur releasing that smell like bad eggs. If you've ever been to Rotorua in New Zealand, you'll know exactly the smell I'm talking about, or anywhere that you get those sulfuric gases coming up through the Earth's crust. That's the smell that those bacteria also produce. So regular oil pulling will kill the bacteria responsible for bad breath, and unlike mouthwashes that can dry out your mouth and make your bad breath worse, oil pulling supports a healthy microbiome and helps to kind of moisturize your mouth so that bad breath is a thing of the past. You must also have good oral hygiene if you want to make sure you don't have bad breath. So I also mentioned that oil pulling may reduce thrush. Coconut oil has antifungal properties, so it can kill the candida, which is responsible for thrush in the mouth. Coconut oil is a very easy, simple, affordable way to reduce oral thrush symptoms. Now, candida is a yeast which, when it overgrows and proliferates in the mouth, causes the infection known as oral thrush. Now, people who get oral thrush are people who wear dentures, especially if they don't keep them clean enough, people with a weakened immune system, undergoing chemo or radiation therapy, using asthma puffers, inhalers, because they're steroidal. That changes the bacteria and your immune response. And if you do use a puffer, guys, please make sure you're rinsing your mouth out with water in large quantities after you've had your puffer. Also have a little gargle so it goes into your throat, so it's clearing out the medicaments from the mouth and throat. And then any medication that changes your oral microbiome is going to put you at risk of oral thrush. So that's things like antibiotics and steroids. Babies also can get oral thrush. They can't oil pull. That's because their microbiome is out of balance, and that's more because your microbiome is probably out of balance as well. So if you can fix that up, then you're going to help baby. So oil pulling, what's it good for? Absolutely nothing. No, sorry. It's good for reducing gingivitis, gum disease. It can help prevent and reverse cavities, the small ones. That's the caveat, the small ones, the ones that are just in your enamel. It can help reduce bad breath and stop bad breath, and it can help treat oral thrush. What are the dangers then with oil pulling? Well, essentially, there are no known side effects, but there are some risks. You do need to be careful. Don't go choking on the oil while you're doing your oil pulling. Don't put so much in there that you can't breathe and move it around without it disappearing down the back of your throat. You've also got to be very careful. In very, very, very rare cases, but it does happen, you can actually inhale some of the fats from the oil, and that can cause, if you're really unlucky, what they call lipid pneumonia, a fat reaction pneumonia. And this is why we don't encourage kiddies, little kids, to oil pull. If you're allergic to coconut, then don't pull with coconut oil. Use something else. Don't swallow the oil. Look, not because it's going to cause you to swallow toxins from your bloodstream, because we've talked about that doesn't work. It does not pull toxins out of your bloodstream. But if you swallow that oil with all the nasty gubbins from your mouth, it can upset your tummy. So make sure you spit it out. And again, we've said into the garbage can, into the rubbish bin, not down the sink, or into your toilet, because if it was a hard fat to start with, it's going to harden in those pipes and cause plumbing problems. Now, oil pulling is not, let me make this very clear, it is not a substitute for brushing and flossing your teeth. It is also not a substitute for regular dental cleanings. It is also not a substitute for deep cleaning or gum therapy if your dentist has prescribed this because you have periodontal disease and pockets with build-up under your gums. I'm ranting, but I need to make this point because I am pissed off from hearing patients say to me, I'm not going to have that treatment, I'm just going to oil pull and that's going to fix it. That is crap. It does not work. You need to treat the disease properly. You need to brush and floss. You need to have regular cleaning. But take a breath, Rachel. It's the dental zone, not the Colosseum. If you want to add oil pulling to your routine and you want to try it out, by all means do, but that does not give you carte blanche. It does not give you a free pass to stop brushing and flossing your teeth or avoid going to the dentist or to not have the treatment that is prescribed because you think oil pulling is going to cure everything. Now, some dental associations and some dentists are not going to recommend oil pulling because there are no reliable studies to show it improves oral health or acts as a preventive measure for oral disease. Now, I'm going to say I don't agree. I mean, hello, these are the associations that are telling us that dental mercury in amalgam fillings is perfectly safe for our health. They're also the associations who are pushing fluoride. So, are we going to accept their advice in this case? I will leave that to you. But there are other associations like the International Academy of Oral Medicine and Toxicology, which I am a member of and have been for many years, regularly encourage this practice, the practice of oil pulling. So, I don't think it can do any harm. I think it does have benefits. I don't think it's the panacea, be all, end all that everybody makes it out to be, but certainly 1 to 3 minutes of vigorously swooshing coconut oil around your mouth a few times a week can help improve your gum health and maintain good oral health and good oral hygiene. Now, what are some of the myths and misconceptions? Well, I've touched on a few of them in my little rant there. Whilst it works to improve your oral health, it kills bad bacteria and allows you to maintain a healthy oral microbiome. It may lower some inflammation and oxidative stress that is impacting the teeth, gums, and mouths. But many myths about oil pulling have been disproven. And look, I've heard them all. Don't think you can run one by me. I'm going to tell you quite frankly, because I'm the blunt kind of girl, that it's bollocks. It doesn't work. And if you're looking for some miracle cure, then I'm afraid to tell you this is not it. So here's some truths. Oil pulling will not, cannot, and does not replace your need to brush and floss. It is an addition, an adjunct, a bonus, a top-up to your oral hygiene routine, and it cannot, absolutely, definitely, should not, will not, does not replace the need for you to brush and floss your teeth. Oil pulling is not a cure-all. It won't fix your gum disease. We have to treat that properly. It won't cure your TMJ issues. It won't fix the great big bloody hole in your mouth. It will not fix a dental abscess or infection. If you've got a dead tooth that needs root canal treatment or extraction, oil pulling is not going to keep that under control or stop the infection. No, it needs proper treatment. Oil pulling will not loosen your dental crowns or fillings. If your filling comes away or your crown falls off, it's not because you were oil pulling. It means that there was already decay underneath, in between, or around that filling or crown that meant it was going to come off anyway. Oil pulling will not whiten your teeth. I don't care how many bloody things are on Instagram, TikTok, whatever social media thing you're part of, and all these influencers going, look how white my teeth are because I oil pulled. It's not true. It does not whiten your teeth. It may make them look a little bit whiter because it can help remove stains caused by bacteria, but it's not going to whiten your teeth. No more than if you swooshed water or a mouthwash around your mouth is going to do the same. Whitening happens because there are products in there that actually whiten, like hydrogen peroxide or carbamine peroxide. Coconut oil pulling will not whiten your teeth. It doesn't cure disease. There's no scientific proof that it can do any of those things that all those Ayurvedic claims make out that they do. It just doesn't wash. It washes your mouth, but not any of these other things. Oil pulling is not going to remove toxins from your bloodstream. So these practitioners who warn that pregnant mothers shouldn't oil pull and you shouldn't swallow the oil because it's going to expose you to toxins. No evidence whatsoever. No evidence that you can pull toxins from your body or that it's even physically possible. That just negates the rules of biology and science. It doesn't work. Do you need to oil pull for 15 to 20 minutes? No, I don't think you do. I think that there's no added benefit for doing it for more than 1 to 3 minutes. I think you may do more harm than good if you do it for that long as well. So no need to do that. Why do you need to floss and brush before you oil pull? Well, some sources say you should do it after, and some say you should do it before. Now, I'm going to be a little bit maybe controversial, and I say I think you should do both. I think you should oil pull before you brush and floss, and this breaks down some of the biofilm and it reconditions it so that you have healthy colonies of good bacteria. And one of the key benefits of oil pulling is that you rebalance the oral microbiome. So if you brush after you oil pull, you'll actually brush away the anti-inflammatory compounds in the oil and limits its ability to support your oral health. So I think have a little swoosh with the oil before you brush, then brush and flush, brush and flush, brush and floss, and then do your 1 to 3 minutes of proper oil pulling afterwards, and then you're going to have the inflammatory compounds there in your mouth for longer. Now, I think it's a very easy practice to learn, but to do it effectively, you've got to do it vigorously. It's probably easier than learning how to brush your teeth, actually. Remember, it's not going to cure any of your diseases or systemic health conditions. It will reduce oral inflammation. It will help you improve your gum health. It will reduce the inflammation and the bacterial loading that is associated with gum disease and the bleeding gums that create. I prefer a good coconut oil due to its anti-inflammatory and antioxidant properties. And like I said, just 1 to 3 minutes a day to get your mouth healthy, and then just 1, 2, maybe 3 times a week in order to help keep your mouth healthy. So this is my thoughts on oil pulling. Like I said, I get asked about it a lot, so I hope that's put to bed some of the myths and brought through some of the facts. I may have upset a few people by being so fervent about this, but if you want to oil pull, it's not going to do you any harm. It's quite beneficial. You don't need to do it for minutes on end, just 1 to 3 minutes. Give it a go, see how it works for you. It's certainly not going to be negative, and I do think that the antibacterial and anti-inflammatory properties of coconut oil are going to be very beneficial to your oral health, and it's a very good add-on to your oral hygiene routine. So this is the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. If you'd like to see me and have me as your dentist, you can give us a call on 0737201811, info@evolvedental.com.au. If you want to know more, hop on over to holisticdentistry.au. If you are listening to this on Apple Podcasts, please give the time to leave a review. Share this with your friends. Let them know about the Dental Zone. Subscribe to the channel. If you're on YouTube, give us a thumbs up. Leave a comment. Just let's get some activity going. If you'd like some topics for me to cover, if you've got questions, then by all means, you can reach out with those. YouTube's probably the best place to do your comments. So thank you very, very, very much once again for listening. I do appreciate it. I'm Dr. Rachel Hall. Until next time, do your oil pulling and stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.